work for CRAC. I am the Underage Nicotine Prevention Coordinator. And today we have with us Leanne Dodge. And Leanne Dodge is a prevention specialist and the program director of SoPro Unite, All Ages, All in a Drug-Free Community Coalition. She has a master's degree in adult and higher education. Previously, she was on the Maine CDC's prevention team and provided oversight and technical assistance to community coalitions across the state. She worked at the University of Southern Maine as the assistant director of student life and coordinator of substance use prevention and wellness. She was the coordinator of HEAPP, Maine's Higher Education Alcohol Prevention Partnership, and worked with over 20 of Maine's campuses on substance use prevention. She has been a prime for life instructor for DEEP, an instructor for the past 20 years and teaches the under 21 program. She worked at the University of New Hampshire as a residence director for 10 years. She lives in Maine with her husband Andy and their yellow lab, Mini Pearl. And I'll pass it on to you, Leanne.
Great. So hi, everybody. And I'm glad if you want the slides from today, if you're like me, afternoons are a little rough, so don't feel like you have to write down all the notes if you want to just get the slides, and my email address if you want more information. And I have a lot of slides, so I'm going to go through it kind of quickly, but I just want to give you a little background on, I'm in Maine. I work in South Portland, Maine, and I live about an hour north of my office. My office is in the high school in South Portland, and we're in year 10 of our Drug-Free Community Coalition. And I'm not from Maine, I'm from Michigan, but then I also lived in Long Island, New York, grew up mostly in New Hampshire, right outside of Keene, New Hampshire, and went to my 15th year high school reunion and re-met someone I had dated for a week junior year. And we have been married almost 25 years. So I always tell kids, like, go to your reunions, there'll be somebody left. And my husband loves when I say that. And I have a sister in Fairfield, Connecticut, and three nephews, one in Norwalk, one in Milford, and one in Hartford, West Hartford, Connecticut. So good to see all of you there. And my dad went to Yale. He was a minister, and he went there back in the 50s. So I know a little bit about Connecticut. And today I'm going to be going over our restorative practice policy and athletic code and why it's been so effective and our process in making that happen. And so without further ado, and again, just kind of talking to you about how effective it has been to change our policy to be restorative rather than punitive, and kind of the ripple effect of how it has made many changes in the community as well. So here's the goals. Again, it's just talking to you about how to change your policy in your schools. And again, the things we've seen that we didn't even expect to have happen. And again, how to include people in your community to make this policy change. We were the second school in the country that used restorative practice for substance use violations. It has now spread to at least 10 other states and Santiago, Chile, where our old superintendent is. And so it's actually international now. So I'm going to walk you through why should you change your policy from kicking kids out of school, using out of school suspension. When I first started in South Portland, so I worked for the whole city, but my office is in the high school. And when I first started, I asked the principal in the springtime, like, hey, how many substance use violations have you had? And he said, oh, about 7. I'm like, okay, well, there's over 800 kids in the school, and the Maine Integrated Youth Health Survey data shows, these numbers. So that's weird that there's only 7 from the whole year. And then digging deeper, realizing, hey, if a kid got caught, they were kicked out of school for 7 to 10 days, sent home, also known as 2 weeks of not being in school. So you could see why maybe teachers might go, oh, Kathy, maybe you're just tired, right? Like, because if I report you, you're out of my class for 2 weeks, and I'm actually held accountable for how well my students do. So again, looking back, like, something was amiss that people were not probably bringing forward concerns around students. So changing the school policy, we know that kicking kids out of school, what do you think someone would do for 7 to 10 days outside of school? And how were their academics when they got back? And there was no kind of welcoming back, let's get you back on board. It was like, get back to class. And we know it doesn't change behavior. What do you think someone's going to do for 2 weeks? Probably still use their substances. So that's not effective. I remember the chief of police we had at the time said, when you kick someone out of school, they're not at home. They are out and about. And we always use that line, like, so what is this young person doing? And parents, can they keep an eye on the student? So again, we know it doesn't change behavior, it increases their use many times, and really looking at it, stigmatizing use with a young person instead of seeing, wait, maybe there's something going on with this young person. They might need some help. And that shame of, wow, you got kicked out. And less likely to have those protective factors that we know are so important in prevention. Connection, as you guys probably use that saying, connection's the opposite of addiction. So now we've kicked you out of school. And also we changed our athletic code we'll talk about. Some schools you can get in trouble once as an athlete. The second time you're banned from sports all 4 years. And you think about that, like for some students, sports is like the only thing really keeping them motivated to be in school. As in my intro, I taught the class for folks who were arrested for operating under the influence for 20 years. And I only taught the under 21 program, but many of those students had been kicked off of teams or suspended or expelled from school for substance use. And now they have an OUI, which on average is $10,000. And it stays on your license for 10 years. Like you just think, what if we got to people sooner? So I'll just talk quickly about our timeline here of how this all unfolded. Again, people in the school in 2013 were getting some more education about how out of school suspension doesn't work. And again, more information about substance use in the brain and how we know that the brain is best for learning from 13 to 20 without much effort. So we have a lot of multilingual students now. Some of them know 6 languages fluently and they're 15 years old. And I kind of kid and go, I kind of know English. Some kids play 4 sports, 6 instruments, right? Their brain's so fabulous. The downside is 90% of addiction starts before the age of 18. So again, kind of that feeling, if we could get to students sooner while we have access to them, 18 to 25-year-olds are our highest risk using group, and we do almost nothing for that age group. Whether you go to college or not, there's not a lot of prevention and intervention going on, and that's our riskiest age group. So we really need to do this work, prevention, while we have access to students while they're in high school. And again, we started doing more trainings in the community on restorative justice and restorative practice. And the other cool thing was our police department started a standard operating procedure where back in the day, if they pulled over a kid or came across someone with substance use violation, they would, hey, Jess, I know your dad. Why don't you head on home? But Ashley, you're getting a summons, right? And so it was, now they've taken the judgment out of that. Now students have a choice. Would you like a summons, or would you like to do our student intervention reintegration program, which is called Prime for Life? And that's the same curriculum we use for OUI offenders. So they did that way back, 10 years ago, and changed their policy. So it, again, took that judgment out of the officer. We then, in 2016, that's when I started my job and got the Drug Free Community Coalition. So again, we're in year 10. And our action plan was to change the policy. And we were able to, again, do trainings around this. And we even taught a course. We had a kind of an expert teach a course for 40 staff members, and it was a 37.5 hour course, so they got credit hours. And that was really powerful because we knew if we don't have teachers on board with this policy, it's not going to fly. If they go, whatever, that's a hug, and say you're sorry, and it actually really is not. Restorative practice is not fun. It's a pretty adult process. And again, really looking at this as a clinical issue, not a moral issue of failing. So thinking about that, we presented to the school board, and we had this lieutenant from the police department speak, this expert in restorative practice, social worker. We all spoke, and right away the school's like, yeah, let's change it. You're right. Out of school suspension doesn't work. So it wasn't a hard sell. I won't read all this, obviously, and you can have access to this. But again, this is what the policy really talked about, is that we need to do more prevention and intervention and use evidence-based strategies to help young people. And again, look at both accountability and support is really what restorative practice is. It's again, it's not just say you're sorry, go back to class. Like, there's more to it, and I'll show you the flow chart. And it looks like it's hard to see on these slides, so we'll make sure you get a copy of this. But how it works is if you got caught vaping in the bathroom, or if you were impaired, right now we've changed it so that actually you get a wellness check first from our school nurse to make sure you're okay. And then sometimes our school resource officer might be involved. If you are dealing drugs, you do get an out of school suspension. So that was a line the superintendent's like, yeah, so safety first in the community. So you might get out of school suspension for that for 3 days. But if you're just using or impaired, then we do a wellness check. We call your parents, come get your kid, and take them home, and we'll kind of let you know what's going on. And then you come back the very next day and you meet with one of our social workers, and you have a formal assessment. Were you just kidding around in the bathroom? Like, I've never even, someone just handed me this. Or have you been using for a couple years and you can't stop? And we'll figure out what is the best intervention for that student. So it's really formed to what's going on with that student. And then we include the parents, the assistant principal. We have an in-school restorative coordinator and a social worker. And right now we're training our youth committee of our coalition in restorative practice, so they can kind of be a student advocate, so that you can have a student there with you. And that group will kind of determine what kind of intervention that student might need. And they also have to do the restorative practice questions that you'll see here too, and do those, whether it is like the student intervention program we can offer, or we now have a gal that does nicotine interventions every Thursday. She uses my office, and students are required to see her if they've been vaping, and they have to go see her one time. Well, many students have seen her more than once, and they don't have to. So it's working to have kind of, again, some more clinicians working on this. And again, then that restorative reentry meeting of like, how are you going to do things differently going forward? Again, this is exactly what I was kind of talking about. And one of the things that we found out after COVID, as some of you might know, we had some ninth graders that were on their third violation, and it's only October because they started using during COVID when they were at home. So we added some pieces to the policy where if it's your second violation, you need to do community service. And this is not picking up trash in an orange jumpsuit. This means you're doing some hours with a community-based youth serving agency like Boys and Girls Club or our Red Bank Teen Center, so that you're working with someone who works with young people. And so it's really more about a connection to another healthy adult. If it's your third violation, you need to do some more community service, and you need to meet with one of our behavioral health liaisons from the police department. And these are licensed social workers. One of them is a 2014 grad from our high school. And was an athlete. And so those folks can meet with you outside of school. They can meet you at your house. So that's been another really key piece to have some additional clinicians helping a student turn things around. We included all these sectors in the community to make this policy happen. So we had youth involved in this and parents. Again, this has improved a lot of relationships with parents. So from going from just come get your kid for 2 weeks to get them today, bring them back tomorrow, and they're not going to fall behind academically. And again, where you see the asterisks, those are the key pieces. We've gotten a lot of media attention. We're on NPR and different statewide media outlets. And again, working with law enforcement and other healthcare professionals, knowing that, and working with people in recovery, that people that work in treatment, all those folks were really helpful in creating this policy. And when we first started with students, and it's really important to involve youth in this work. And our committee, we started with about 12 students back when we first started. Now we've had close to over 400 students that have been in our youth group, 100 siblings that have been in the group. And when we first talked about this policy, then you have to go and you have to go through the restorative process and meet with your parents and the assistant principal all together. They said, I think we'd rather be suspended. And I remember being like, what? And then going, yeah, shoot, not having to do all that adult process and just go home for a while. That sounds way better. And again, our students did a panel for faculty and with coaches. And they really were the ones that helped change our athletic code, where you don't get kicked off of teams. You can still go to practice. You can't play in games for 10 days. But back in the day, it used to be like, do not step on this field. You are dead to us. You don't come to a game. You don't go to practice. The first time as an athlete, if you violated the code, it was 14 days kicked off. Second time, 10 weeks. Third time, a season. And so now they're still a part of that community and they need to go through the process with their team and their coach. And I remember, again, talking to one of our students. We have a program called Sidekicks that teaches students about motivational interviewing, how to talk to your friend about risky behaviors. And I was like, you guys, what are we going to do about this vaping? Like, what would you do if you knew your friend was using? Like, what would you say to them? And this one gal, Cassandra, said, I would say I can help you through it. And again, involving youth in this work is critical because often youth are going to go to other youth first before they walk downstairs to the social worker. That really getting youth involved is really important. The other thing, what our golf coach at the time, when we were changing the athletic code, which was tricky to do because the head athletic director was like, it's a privilege to be an athlete. And so it was a hard sell. And then they finally agreed to it because our student athletes met with the coaches and said, you know what, when there's someone using on a team, there's a lot of secrecy. And there's lots of, again, you don't want to get someone in trouble because they're going to get kicked off the team. So you just hush, hush and don't talk about it. And at the time, our golf coach said, well, none of our students use, so that's fine. And of course, a week later, one of the golf kids got caught using. And wouldn't be what I would do, but he made the student get up on the bus on the way to the golf meet and tell everyone why he wasn't going to be participating. And one of our SOPO Unite students said to him, do you want me to stand up with you? And so again, having youth involved can be really supportive in this work. And again, looking at the long-term effects of when people are suspended out of school or removed from athletics, you probably all know stories of people that had made a big negative impact on their development. So again, here's the code of conduct, which I've already kind of talked about. It's a similar process. And with that restorative process, working with the social worker and perhaps having an intervention depending on what's going on for them. And these are the restorative process questions that we use. And we also use a behavior chain that I could send to folks too. But this is what a student, when they do spend that day in the in-school restorative coordinator's office, this is what they have to write out. And this is what they're going to share with their parent, the assistant principal, and the social worker in that circle, in that restorative practice group. What happened? What were you thinking at the time? What have you thought about since? Who's been affected by what you've done, in what ways, and what do you think you need to do to make things right? And then I just want to share some of the ripple effects of how positive this code and policy change has been. So the big thing is parents. Now, back in the day, if we made you go home for 2 weeks, parents, that was rough. And they really, like, what am I supposed to do? Like, I can't miss work. Do I have to stay home with my kid? Or they're going to fall behind. Like, this isn't going to work. So now parents are much more on board to come in and be part of that process with their student. Like, what can we do? What do we need to put in place to make the change for you? So better parent engagement. And I remember way back hearing from a parent was saying that their son had been caught as a freshman. And this was when we used to suspend people out of school. And they said, then as senior, you got in trouble again. And they said, if he had that same old policy now as a senior, he would not have graduated. And really, when you think about, depending on when it is in the year, if it's the beginning of the semester and you're out for 2 weeks, how's that catching up going to go? Not well. So again, really improving the parent engagement, and again, having a better school climate where students now know that they're probably going to get help and they're held accountable, but they're not going to get kicked out. And I know one of our assistant principals was saying, even last year, he had a student and he was like, hey, you need to turn out your pockets. We just caught you vaping in the bathroom. And the student was like, I'm not doing it. And he reassured him and reminded him of our policy, like, you're not getting kicked out of school. It's not a 2-week out of school suspension. And the student undid his pockets and showed him what he had. So again, reminding people of that. So changing the school climate, and then again, providing resources that a student might not have been able to have if they were kicked out. Some other key people, and this ripple effect is with our social worker and their key role, that we know that restorative process, and providing support for a student, they're more likely to stay in school and to graduate and do okay academically and get support. Now teachers will come down and bring the kids their homework while they're out of their classroom for that day, right? So they know they're not going to fall behind academically. And again, having those coaches not lose someone on a team. Again, you could see how people might go, I'm not gonna, he's our star player. Let's not say anything about this. Now kind of going, all right, you're not going to get to play in games for 10 days, but you're still part of the team. And again, having students be aware of the policy and helping other students has been a big positive outcome. Our school resource officers have been really positive in this work as well. And again, it's more helpful. And so the students have had a really close, connection with their school resource officers, knowing that they really want to see them get better or get the help they need instead of punitive and summons and you're getting kicked out. And now to really have students feel like they can come clean and, turn in their devices or ask for help. We also have a voluntary part of the code where you can come forward before you even get caught and just say, hey, I'm struggling. I need some support, or having your friend bring you in. And so really thinking about, hey, if we have that community of, we actually want to help you, not harm you, is really the goal. And again, hearing from our assistant principals, again, doing more with parents, having, we do restorative parent nights now. We're on our 19th one. So we do parent restorative support circles. And that is not connected to the policy, but it's just an opportunity for parents to connect. And really raise your hand if you think parents ever get together and talk about kind of the challenges of parenting. We don't do that. And parents don't really have an opportunity to do that. So we do these parent restorative circles now every month in the high school in the evenings. So it's really changed our whole community. And now our other youth serving agencies also use restorative practice. So I remember when I first started the Red Bank Teen Center, a young man who was in eighth grade had brought a knife to the teen center. And the head of Parks and Rec, who's not there anymore, so I can talk about it, he's like, we need to ban that kid from the teen center for a year. And then he said, you know what, we should also let the Boys and Girls Club know so that they ban him from there too. Luckily, they had a really good teen center coordinator who said, how about we meet with the single dad and the kid and have them sign a document that says they're not going to bring a knife anymore. Again, taking away protective factors is not the way to go. So again, these other agencies have now adopted the policy. It's also the model policy now for the Department of Ed in Maine, and has been in in other states as well. Again, this other piece that we've done now, when we first met with some of our Soapy Night students, a lot of them were white athletes. And I remember saying, hey, that's so cool. You're a captain. What kind of training do you have? And they looked at me blankly like, what training? And you thought, oh gosh, how did you get picked as a captain? Oh, the coach picked me, or other kids got to vote. And so now, over the past 3 years, we were doing 1 hour trainings each season for all the captains of all the sports teams. And sometimes captains are captains more than once. So one of our students said, I almost fell asleep during the last training because I've been through it a couple times. So now last spring, we did a focus group with all the captains about what would you want to learn about as a captain. And so now we're doing a 9-session leadership academy for 9th through 12th graders who were handpicked, 5 different students from each team. So we have 80 students that are going through a leadership academy throughout the year on our half days, the professional development days for staff. And it's been very powerful. We've already done 5 of the sessions. And one of the coolest one is we had college and university coaches and athletes do a panel and talk about the difference between high school and college athletics. And we've done I'll be doing one on substance use prevention, and we have a nutritionist coming in, etc. So you can see how things can evolve and get better and be more effective as time goes on. So again, working with coaches, and we're now going to change our co-curricular code. When you think about, well, why are athletes having to sign a special code? What about kids in other groups like marching band or drama club? So some similarities, but also kind of being held accountable for their behaviors. Again, you'll talk to the marching band director, and he said, oh, none of the kids in band use. You're like, well, interesting. I just heard you guys went on a trip to New York to see Wicked and kids were drinking on the bus. Like, why are athletes special? So we'll be changing that co-curricular code so that students are, again, need to realize what kind of expectations we have for young people. And back to the coaches, we actually really work when we're hiring new coaches to see that they're on board with restorative practice athletic code. Because again, some were like, it's a privilege. If you screw up, you're off the team. You're like, you're a protective factor. So the other pieces here is that really getting resources from your community, whether it's in school or outside of schools, to help with this process. And again, we're lucky to have 6 social workers now in the school, and a couple of them are licensed alcohol and drug counselors. And they are trained in the Prime for Life curriculum, some of them. there's another program in Maine called My Life, My Quit. And again, we do trainings in the community so people are aware of what restorative practice is. And again, we have been able to send people to trainings about restorative practice. So I would recommend that too, to get some kind of experts in to teach about that. And again, we have a full-time in-school restorative coordinator. Again, we've been able to do some outreach around this, and our students met up with the legislators up in Augusta, Maine at the Capitol back in 2018, I believe, and again, educating them about how this policy is more effective than out of school suspension. And then we've been out again. I was telling you, we're on NPR and we've been doing some TV interviews and things. And again, other states and places in Maine. It was interesting in the beginning. People were like, yeah, tell us how it goes. Maybe we'll do it, but you guys go first and see if this works. Get your superintendent to try it, but ours isn't going to do it until they see that it works. So now people after COVID have definitely said, what's the worst thing we can do right now is send a kid home after COVID. Are you kidding? We need to keep kids in school. And we were also part of Substance Abuse Mental Health Services, SAMHSA's guidebook on community engagement. So again, just knowing that it's not rocket science to change this policy. And people might go, we don't have a full-time in-school coordinator. We don't have a, hey, start with having the kids sit in the conference room by the principal's office doing their homework. Do not kick them out for 7 to 10 days. That doesn't work. And I will send you anyone who wants this. This is a handout on how to build capacity to do this policy change in your community. And again, kind of lays out what kind of can be really helpful into, those 12 sectors. How do you educate people about this policy? And it's fun to watch if you go and talk to little kids about this, seventh graders or fifth graders, and you kind of say, so if someone was kicked out for, 2 weeks of school, what do you think they'd be doing during that time? And young people, though, they'll probably still keep using. So again, it's not like, no kidding, like anybody would know that. Or what about how might their mental health be being out of school for that long? Not good, right? So people understand that that out of school suspension does not work. And again, to involve law enforcement and get them on board as well, doing trainings. The bummer is there's always a new principal or a new coach you got to train. So this work is never done. You've got to revolving and new students that were like, what's the code? What's the policy? So having the opportunity to educate students and parents and coaches and teachers with this process. And one of the key things that I hope you'll use, this is the ripple effect mapping kind of strategy. And if you ever want to, this is crazy, I know, to look at, but really thinking about, this is something that was done in Maine, process, or not about the policy, but if you look at the ripple effect that policy change has made in a community, it's really powerful to kind of, like I showed you some of those. When we now have over 400 students that have been in part of our group because of this policy change, and the other successes the students have been a part of because of that successful big change. Our students helped pass the flavored tobacco ban here in South Portland. And so our students spoke to city council members, and that's who they wanted to hear from, young people. We helped write a book, a graphic novel about problem gambling, which sometimes starts at age 10. So our students, 4 of our students are the characters in the book. And now that's in 23 states, and it has a health class curriculum for 6th through 12th graders. And, unfortunately, Maine has, legalized sports betting. Thanks a lot. I don't know if Connecticut has that too, but, just thinking about policy change is big. And I don't think we'll ever go back to kicking people out of school. Like it's permanent and it's a real positive piece. So those are all my slides, but I wanted to leave time for questions. So I'll just open it up to people and I can click out of this and just open it up for questions that people might have. And I talked fast, I guess.